If you have acute sacroiliac joint pain and you're looking for some home exercises to start to loosen things up, then this video is for you. So your sacroiliac joint is this joint between the sacrum and the ilium, so in here. And when that gets inflamed and sore, often you really struggle to put weight on whatever side the sacroiliac joint is inflamed. So say it's inflamed on the right here, you might find that even walking is hard, so you sort of end up putting most of your weight on the other side to offload that sacroiliac joint. Climbing stairs is often very hard, so you might find yourself going up that leg and then just lift this up to the same step, and then the other leg, because you can't have the weight of climbing the stair on that side. Same with putting your socks on. You might be fine standing on this leg, putting your sock on, and then when you're trying to lift that, you just feel like you can't, and you have to sit down to put the sock on. So all that intense lower back pain to one side, we really struggle to load one leg, is pointing towards the sacroiliac joint issue. So things that can cause the sacroiliac joints to get inflamed or get thrown out of alignment, it could be something like a fall. So say you have a fall and you land heavy on one side of the pelvis, that can sort of traumatize this joint. It's also common to strain it from repetitive postures, like if you're sleeping on your side with one side of the pelvis sort of reaching forward like that, they can strain the joint if it's for a long period of time. So just sort of pulling that around and straining the joint there. Or if you're driving and having to reach for that leg for extended period of time, as that sort of shoots that hip and pelvis forward, that can sort of throw that joint out as well. A hard workout, if you really work out hard, that can cause muscle buildup in the lower back or in your glutes, more so on one side, particularly if it's a asymmetric exercise. So I don't know if you're doing golf or something that keeps spinning one direction, that muscle tension afterwards can sort of throw the pelvis out. And in general, with all these joint issues, if you got a lot of tension build up, that means that the deep muscle that sense the alignment, that sense what's going on, can't communicate the position properly, which means that you're likely to twinge it over and over again because you can't sense what's going on. And each time you twinge it, it gets more sore, so muscles cramp up more, and you get stuck in that holding pattern of overguarding and undersensing. So what we want to do is to figure out some exercises to loosen that up. So first of all, we're going to start with where we're using the foam roller. They're particularly good with the muscles that go from the pelvis and down towards your thighs. So we have your glutes, for example. Sitting here, you can just roll up and down the glute. Well, I quite like the figure 4 position here. We get a bit of a stretch to the muscle as well. You can do more towards the front as well. So you have your TFL, tensor fascia lata here. We can do rectus femoris, that goes from the pelvis and down towards the knee, more straight in front of the thigh. So if there's anything you find that's a bit sore and tight, then you can just pin that between the that muscle between the foam roller and the bone, and get a trigger point release. So that's your first tool. Next up is just classic stretches. So once again, glutes, can do like that, just hugging your knee. Or if you want to do more glute med, min and piriformis, if you're sitting tall with the knee down like this and lean forward, that's a good stretch there. If your back is really sore, you might feel more comfortable do that one lying down. So small your back is supported against the ground, and stretch here. If you move up a bit with the muscles going from the pelvis up towards the spine, you can do a spinal twist here from the same position. Then you get the glute and a bit of the spine at the same time. Just feel it wherever you're more tight. So you can do it both directions. Or you can just do it more simply like this. Then you tend to focus more just on the muscles from the pelvis and up to the spine. Another way to get those muscles between the pelvis and the spine, it's more like a QL, quadratus lumborum stretch. You can go various angles to stretch that. If it's been a long-term issue and it's been inflamed on and off for a long period of time, often you can get some fibrotic scar tissue building up. So for example, in your hip flexor, you have your iliopsoas that goes from the thigh bone up to the spine and the inside of the pelvis. So particularly one that goes inside the pelvis, if that's tight, obviously, that will pull on the pelvis. So that's called iliacus, that muscle. So we're going to use some weights for these ones. So here we're going to do a lunge that's really deep. So this knee shoots right forward. I grab on tiptoe on that foot while keeping the back leg as straight as I can and the spine up tall. So forward here. So the straighter the back leg is, the stronger the stretch at the front of the hip there. Can do reps there. Some other good options with using weight to really stretch, get deep stretch of those muscles. If I'm sitting here with knees pushing out wide, use that weight, straight spine, and pulls me down for a stretch there. Once again, can do reps. And if you want to get the hamstrings more, you can straighten your knees. Do a similar thing. So straight knees, bum shoots back, and stretch forward. Or if you have a sore back, you're probably safer to keep it down low so you can drop it to the ground. So the wider I go here, the more the focus on the adductor, if a bit closer together, more focus on hamstring. But both those muscles attach to the pelvis, so when they're tight, they can cause that uneven load on the pelvis, pulling on the pelvis, and if they're tight, they also inhibit those deeper position sensors, which can cause that repetitive trauma. So the whole idea here is to relax the muscles, they run between the pelvis and the spine or rib cage or thigh bone. So get them to relax so you can get some movement in there, you can start to sense the alignment and get out of that holding pattern. So yeah, try it out and good luck.